What is fibromyalgia?
Think of the word myalgia to mean pain, algia meaning pain, myo meaning muscle, fibro meaning the fibers where the muscle attaches to the bone. So you have muscles and fibers that hurt.
More common in men or women?
More common in women, more common in younger women, that is under the age of 40, and appears to not get more frequent as they get older. It's that age group where it starts. If you don't have it and you make it to 65, you probably aren't going to get it.
Good. I've made it. Tell me, what muscles ache? Every muscle you got or certain ones?
In many patients, every muscle aches. And that's one of the big problems. It's finding out where exactly. We have a scale of tender spots. And these are particular points where a muscle attaches at the elbow, at the shoulder, at the back of the neck, here at the sternum, over the hips. And there are 11 of these spots. We push on them, and you then can put a picture of the patient. And as you treat, you can sometimes see the number go down, and then when they get worse, the number goes back up.
Now, we've got muscles in the calves, and we've got muscles in the abdomen, got muscles in the low back. Is that part of the fibromyalgia picture, or just not these 11 points?
It's part of the picture. Muscles that are most frequently involved are the ones around the elbow, shoulder, hip, knee. Though some people do have abdominal and chest wall pain, that's not the standard, but it does happen.
How big are these spots? Are they this big or this big?
Probably the size of a quarter.
Really tender to touch, or they just ache?
No, they're very tender to touch. There are special little machines that tell you how much pressure you're putting on one of these spots, and we can put them on you and put them on the patient with the exact same amount of pressure. And the patient says, "I don't like you anymore," and you say, "Yeah, that's there, but it doesn't bother me."
So the symptoms are muscle pains and aches. Do they have constitutional symptoms?
Fatigue is a huge symptom. Fatigue and tiredness that is always there. And the problem with pain, fatigue, and tiredness is it gets mixed up with so many other problems.
Talking about other problems, I take it if somebody is coming in complaining of aches and pains, that you've got to rule out some other problems. What are some of the other conditions that you have to think about?
One of the big things that we want to do is to look at the rheumatic diseases like rheumatoid arthritis and lupus and scleroderma and those type of diseases, because again, those patients hurt around joints. The other big group is patients who have pain, and they don't really fit the fibromyalgia picture, but they do hurt and they need help. And it's trying to pick those different patients out.
Is it hard to pick those out? If somebody just hurts, but they don't have fibromyalgia, I would think that would be very hard.
It's very difficult. There are no blood tests, there are no x-rays, there are no objective tests, so you depend on the patient to help you make this diagnosis.
You would think that if somebody's having muscle tenderness, muscle pain, with all of the tests that we have looking for muscle disease or joint disease or inflammation disease, that something would show up. Why does it not show up?
That's a $64 question. There are a lot of people working on fibromyalgia. It's a big problem in the country. And they are looking to see if we can find a test that would help us understand what's going on. There's a lot of new research suggesting that instead of being in the muscle at this point, it's really in the nerve. And it's not in the muscle.
Can you test nerves? Is there a substance P, or is there an overactive substance that's in the nerve endings?
There are a number of substances that have been talked about. There is nothing black and white yet. But one of the things that we're seeing with especially these new functional MRIs is that parts of the brain in patients with fibro light up with stimulation where they would not in you and me. And it's thought to be some kind of chemical reaction to pain that we don't understand.